Hi everyone, Dr. Nemechek here. I want to talk about the use of rifaximin in adults, just my general approach, how it goes, how do you feel when you're taking it, how do you stop it. So, quick review, it's a very unique antibiotic, all right? The only thing it can do is help improve the balance of your bacteria. That's it. There's very few antibiotics that can do this, none as consistently as rifaximin. It's the only known antibiotic that won't damage your biome. It's the only known antibiotic where there is no long-term resistance, so the drug won't quit working after a while. And it's one of the very few drugs that does not get in your bloodstream. So it won't interact with any other medicines you have. It can't irritate your liver. If it can't even get to the liver in the bloodstream, it's very, very safe. So it's a very unique medication. Now, adults need fish oil and olive oil. Most need a vagal stimulator to recover, and they all need rifaximin to recover. And I mean recover from chronic neurological problems, and specifically what I've focused on is autonomics, but this helps with chronic depression, a whole lot of other things, all right? And so if the symptoms are fairly mild in terms of how they've disrupted somebody's life, and the patients have some intestinal symptoms like tomato gives them heartburn or something like that, I'll start with just 10 days of rifaximin, so it's twice a day. I'll just do a 10-day course and see how it goes. Now we're also doing the fish oil and olive oil and the vagal stimulator, but I'll do a 10-day course. If people do well, they'll be like, wow, kind of in a week or two, I could already tell my intestinal tract was better. And if we balance their bacteria properly and it stays that way, they might not need another round for a few to several months. And how do they know? Those same intestinal things came back. So for me, if I get overgrowth or SIBO, coffee and red wine make me really nauseated. Once I get on rifaximin, before 4 or 5 days on it, somewhere around there, it all goes away. And then I know when to take it again. It could be a year later that suddenly coffee and red wine make me sick again. And so that's kind of a typical for a mild course or a mild set of symptoms. Now, if it's a little more complicated, if somebody is severely affected neurologically, and so we see this in our long hauler COVID patients, and then sometimes they have no intestinal symptoms from SIBO, and that can be 25-30% there. And so in those patients, I'll put them on twice a day rifaximin nonstop. And for the long haulers, it's just that we got to help these people get functioning, get back on their feet, start getting a little hope, and so forth. They may take it for 4 months, 6, 8 months, just depending how long it's taking them to recover. How long does it take to recover depends how bad off you are. The worse you are, the longer to recovery, right? That kind of makes sense. And so we'll do that. And the patients where they have no symptoms, it's just difficult because we can't see the relapsing, so we'll keep them on it. I typically will do 4 months. Now, when you're on continuous, and I should add, when people start, they don't really, some people say, boy, the first day or two was a little gurgly, but they aren't talking about vomiting. There's no diarrhea. There's no die-off, any of that stuff. None of that, okay? And but say we're out 4 or 6 months after continuous, the patient's feeling a lot better, and then we just stop it, and we coast them. And then what happens? Well, I help them understand, these symptoms, XYZ got better within the first week when you were on it. We call that the SIBO fingerprint. It's typically some intestinal stuff, but it could be lightheadedness improved a lot, anxiety improves a lot, and then you look for those things after you stop the rifaximin for when they come back. It could be in a month. Typically, it's several months. And when they come back, you take just 10 days again. And they'll go away, SIBO goes away, but you're still, the whole time too, you're still taking fish oil and olive oil and maybe the VNS, depending how much you've recovered. and you're cruising along, and it could be another 6 months, 12 months. Hey, XYZ came back, those symptoms, you take another 10 days, and so on and so forth. And that's how the whole thing starts and finishes. So I hope that helps give you all a little perspective when you're working with your doctor on, tackling your problems. Everybody have a great day. Oh, and remember, if you are having trouble and it's getting really confusing, come out to Arizona for one visit. You just come here for one. If we need, we do some Skype follow-ups. We can do that for about 18 months. Usually in half that time, most of the people are all fixed and you don't need me anymore. So sometimes just a visit here can help a great deal. Everybody have a great day. Bye.